In the lower limb, we have three main joints: the hip, the knee, and the ankle, right? So let's start with the hip joint. Let's review the movements of the hip joint. What's the name of this action? Flexion of the hip. This? Extension of the hip. This, when I'm moving a limb away from the midline? Abduction, and when I move it closer to the midline, abduction, right? What about this?
Medial rotation.
Medial rotation?
Lateral rotation.
Lateral rotation. Okay. So let's start with the muscles that do flexion of the hip. Okay? Those are this muscle. So these two things form one single muscle that is called iliopsoas. Okay? Main flexor of the hip. So when you flex the hip, you are contracting this muscle. Okay? There is a synergist, this little muscle here called pectineus. It also flexes the hip. Okay? Alright, so that's it for flexion of the hip. Now, let's look at the antagonists. In other words, the muscles that do the opposite. So those are the gluteal muscles. Okay? Those extend the hip. We have several gluteal muscles. This is the largest. So which muscle is this? Gluteus maximus. And this one is gluteus medius. If you want to give an intramuscular injection to this patient, where would you give that injection?
Is it a
Gluteus medius.
Here or here?
Medius.
In the gluteus medius. Not in the gluteus maximus, because if you give it in the gluteus maximus, you can damage this nerve, that is the sciatic nerve, right? Okay. So these muscles are extensors.